Ice cream and other sugary desserts, such as puddings, custards, frozen yogurts with added sugar, and sweetened pastries, represent a particularly dangerous category of foods for individuals living with diabetes because they combine high levels of simple sugars with significant amounts of saturated or trans fats. This combination is especially detrimental to glycemic control and long-term metabolic health. The sugars in these desserts are rapidly absorbed into the bloodstream, causing abrupt spikes in blood glucose. For people with diabetes, whose insulin response is already compromised, these postprandial surges place immense stress on the pancreas, forcing the beta cells to overproduce insulin. Chronic exposure to such surges accelerates pancreatic exhaustion and exacerbates insulin resistance, making it progressively harder to manage blood glucose levels effectively. The high fat content in ice cream and similar desserts compounds the problem. Saturated and trans fats interfere with insulin signaling pathways, worsening insulin resistance at a cellular level. This means that not only does sugar trigger a rapid blood glucose rise, but the accompanying fats impair the body's ability to respond effectively, creating a double burden on metabolic control. Over time, this contributes to the development of central obesity and visceral fat accumulation, which are strongly associated with systemic inflammation, cardiovascular disease, and worsening insulin resistance, factors that further complicate diabetes management. In addition to the acute metabolic impact, frequent consumption of sugary desserts has broader, long-term health consequences. High intake of added sugars and unhealthy fats has been linked to dyslipidemia, including elevated triglycerides, decreased HDL cholesterol, and increased formation of atherogenic LDL particles. These lipid disturbances accelerate the development of atherosclerosis, significantly increasing the risk of heart attack, stroke, and peripheral vascular disease. For individuals with diabetes, who already have an elevated baseline cardiovascular risk, regular consumption of ice cream and sugary desserts is essentially a compounding factor, magnifying the probability of life-threatening complications over time. Behaviorally, ice cream and desserts are highly palatable and can encourage habitual overconsumption. The combination of sweetness, fat, and creamy texture triggers strong cravings, leading to repeated, uncontrolled consumption throughout the day. Even small portions, when consumed consistently, contribute to cumulative glucose fluctuations, weight gain, and progressive metabolic deterioration. The psychological and behavioral reinforcement of sugar and fat cravings also undermines long-term adherence to dietary management strategies, making diabetes harder to control and increasing reliance on medications. Epidemiological and clinical studies support these observations, demonstrating that diets high in added sugars and unhealthy fats correlate with poor glycemic control, faster progression of type 2 diabetes, and heightened cardiovascular risk. Substituting lower glycemic, fiber-rich, and unsaturated fat alternatives can significantly improve blood glucose stability, reduce insulin demand, and mitigate complications. This evidence underscores that ice cream and sugary desserts are not just occasional indulgences, but active contributors to metabolic deterioration. Avoiding them is crucial for preserving pancreatic function, maintaining insulin sensitivity, controlling weight, and reducing the long-term risk of vascular, renal, and neural complications. The danger is cumulative and insidious, meaning that even seemingly moderate consumption can silently exacerbate diabetes progression over time.